Hello, Dr. Farina. How are you?
I'm good, thank you.
Thanks for taking out the time for us. I understand you underwent neurosurgery only recently.
That's right. It was about 2 weeks ago that I underwent uh, surgery for a left frontal lobe meningioma.
Okay. Before we talk about the surgery, would you be able to tell us a little bit about how was it diagnosed? Was it an incidental finding, or how did it happen?
Well, one evening I was just going down the stairs in my house, and halfway down the stairs I fell flat on my face about 6 steps. So when I went to the accident emergency department, they did a few tests, one of which was an MRI brain, and they picked it up on that.
Okay. Was that the only investigation which revealed it, or was it something else as well?
Initially, they thought that it was a cardiac issue because usually with a cardiac arrhythmia or TIA, you have such kind of falls. But when they thought that the cardiac test not looked normal, they decided to go and investigate the brain, and that's when I got diagnosed.
Right. Okay. And did you have the operation immediately, or was there an interval of some time before you were operated upon?
My doctors thought that it was a benign tumor, but the location in the frontal lobe was not a great thing to have. They recommended that I have the surgery at some stage, but it took me 6 months to decide to go ahead with it, considering the risks and the personality change and other lifestyle changes that I would have to make with it.
Right. So just to recapitulate for our listeners, your tumor, which was thought to be a meningioma at that stage, was in the left frontal lobe. And you yourself, a doctor, would you be able to tell us what is the function of the frontal lobe, and with special reference to the location of this tumor, what would have been the function of this place?
Sure. First of all, the left frontal lobe for me is important because I'm right-handed, so it affects my writing, my speech, my emotions, and higher mental faculties. Basically, the frontal lobe is the executive decision-making center. So that is why I took my time to decide to go ahead with it. Secondly, the size of the tumor was the issue, and I thought that if it is a benign tumor, we might as well wait and have a surveillance scan to see if it's growing, which is what I had at about 4 to 5 months. There was a minimal increase, and that made me decide that if the tumor is increasing, there's no point in waiting and we should go ahead with the surgery.
Great. Now, would you be able to clarify a little bit what is minimal increase? Are we talking in centimeters or millimeters, or what would be considered minimum, and what would be referred to as a moderate increase?
When I got diagnosed, the tumor was 1.8 by 2 millimeters, and in 5 months' time, it grew by 1 to 2 millimeters. And that is average for a meningioma. It is a slow-growing tumor. However, because of the location, I thought that it would be a good idea to get it out, although the increase was minimum. But you see, the risk of seizure was the main issue. And so far, I had not had any seizure. I had a collapse, possibly a blackout, and it could have been just an incidental happening because it never happened again. But I wasn't willing to take the chance of a seizure.
Right. Now, coming up to your surgery, I'll come to that in a minute. I just want to know, how did you prepare yourself for such a big ordeal which was in front of you?
There are several ways. First of all, you have to deal with it emotionally, come to terms with the risks, and accept them. And then, secondly, there was a lot of legal and paperwork to be done in my situation to make sure that all my affairs are in order, my property, my will, my family. So when I had all these supports and backups arranged, I went ahead. And the only thing I will say is that one has to have faith. I had faith in my doctor, I had faith in my God. Whatever your faith may be, you have to trust in the higher power.
Okay. So, which country are you located in?
I'm in Ireland at the moment, but my parents are originally from Pakistan.
Okay.
So I come from a Muslim background.
All right. Okay. So your surgery took place in Ireland.
Yes, in Ireland, in Beaumont Hospital, which is the top neurosurgical centre in Ireland.
Okay. And now, let us say one day before the surgery, were you asked to have any tests done, or were they already were they already in place?
I had already had a scan for surveillance about 3 weeks ago, but my neurosurgeon wanted to be very precise and they wanted to make sure that they had marked the areas that they were going to do the incision and say somewhat of a simulation scan which would enable them to go through surgery. So the day before my surgery, I went to have a CT scan and then an MRI so that they could basically simulate the operation and do the surface markings, as they call them.
Okay. So that was done a day earlier.
A day earlier, and
Okay.
that evening I got admitted after the scans to be operated on the next morning.
On the next morning. And were you asked to stay fasting for a certain duration of time?
That's right. It's routine for surgery to be fasting the midnight before the day of your surgery. And my operation was third on the list, which is around 2 p.m. But I was fasting since 12 midnight the previous night.
Okay, so now let's get you to the stage where you were told that you are the next person to be operated upon. So what was going through your mind, and what was the preparation done from the nursing and medical point of view?
I was completely calm for my operation because the decision had been made. I had complete faith in my doctor and I had faith in my God, Allah. I went with full confidence, prepared for any eventuality, and the nursing staff were very helpful. It's really a very personalized service. The nurse on the ward brings you down to theatre after the consultant has taken your consent. Then I went into the theatre, which was a beautiful place. It gave me peace going inside the doors. And then 3 times the team in the theatre checked with me again whether I knew what was going on, what the diagnosis was, and whether or not I was still consenting to go ahead with it. And initially it was the theatre team, then it was the anesthetics team, then it was the neurosurgical team. And these 3 consents highlighted the risks and still wanted to make sure that I was willing to go ahead and prepared to take the risk. I said yes to all of them.
Okay, excellent. So, did you have a big incision somewhere on your scalp?
It was a fantastic incision. In fact, I have a picture what I'd like to share with you. Because initially the thought was that they might shave my head, but they didn't. And what they do nowadays is to have a wide parting on the hairline, and I'll show you what it was like.
Yeah, please take your time. That's okay.
They do a wide incision from the parting and then peel off the skin and the layers of the scalp to expose the skull, and then they drill a window into the skull. So if I can just show you this picture, that is the incision with the staples. That's just the skin incision.
Yes,
Is that
we can.
visible?
Yeah, absolutely.
Yes.
We can see that.
Yes.
That's a wide, I would say about 9 to 10 centimeter incision, starting from just above the forehead and circumferentially tapering down way below your left ear.
That's right. Started
Fine.
from the frontal lobe and went all the way down to the back of the scalp.
So this could easily be called as a frontoparietal incision.
That's correct. That's the technical name. I'll show you my pictures. That's how I was post-op.
So this is like immediate post-op, or
Yes, the day after the operation.
the same day as the operation?
That's right.
Okay.
I'll show you some more pictures. I'm enjoying my Diet Coke.
Okay, so you were actually having Diet Coke the same day as you were operated upon?
That's right. Somehow you wake up very thirsty and you need a cool drink between water and Diet Coke.
It's a great advertisement for Coca-Cola. Okay.
Coincidentally.
Yeah.
So I did really well on that day.
Okay, and then what happened in the days ensuing your surgery? Let us say your first post-op day. How was that?
My first post-operative was very good. I think I was high on the morphine and I was in very good form. I felt really good and the pain control was adequate. Although after brain surgery they do not give much opioid, what they do is give IV paracetamol and IV non-steroidal anti-inflammatory drugs. But in my case, they gave me some top-up of oxynol, which is a refined sort of morphine. That was only allowed if and when I needed it, which I avoided constantly because, in my experience, opioids or morphine-related drugs, they cause a lot of constipation and vomiting. So I took minimal of that. However, it made me go through the first 24-48 hours very well.
Okay, so most people, now immediately after the operation, did you have any neurological deficit, or did you feel that you're not able to do anything, or remember, or speak, or any kind of a deficit? Did you notice anything?
No, I was very lucky, and in the neurosurgical unit, they check you every hour with your GCS, which is the Glasgow Coma Scale. In that, they check your orientation, your conscious level, your pain levels, and every hour to 2 hours, they check your blood pressure as well. So I was very lucky that I didn't have any neurological deficit or stroke or stuttered speech as they expected. Well, what I did have was a really, really miserable headache.
Okay, so I would like to know a little bit more about the type of this headache that you were experiencing.
The first thing I will say is that it's not like any other headache that you've ever experienced before. It's an intracranial headache, which means that there are pressures within the brain that are changing, and it really feels like there's a bomb trying to explode through your head, multiple foci of infection. Well, not infection, but inflammation, and a lot of areas of pulsations, which is what I noticed. So between pressure, pulsations, and expansion of the brain in different directions, that's what it felt like.
Okay.
It's unbearable.
Okay. And were you conscious all the time, or were you feeling nauseous or any other feeling associated with the headache, or was it just the headache?
I was awake and conscious, but I could barely speak. I could barely keep my eyes open because the pressure and the thumping headache, it was killing me.
So is there any special reason that you were not provided with painkillers, or is this the norm, or is it other than the norm?
I was provided with a lot of painkillers, but they just weren't working.
I see. So how long did this episode of pain, as you described, lasted?
For 5 days, I was miserable.
You were miserable
I was
absolutely for
miserable
5 days.
5 days.
Okay.
And at that stage, when I started to dip after 48 hours, what happened is that I was shivering. I was developing a temperature. I was worried that I was going to have meningitis. And the routine of the hospital is to take blood cultures. And until there's an outcome of the culture, they wouldn't start an antibiotic. That was the first thing. The second thing was the steroids were not started because they were waiting to see whether or not the pressure headache was edema related. And
Sorry, edema is swelling?
Swelling.
Of the brain, I guess.
Of the brain.
Yeah.
And the reason they didn't think that there was swelling or edema is because it didn't show up on the scan when I had my post-op scan in 48 hours. So they were at no other choice but to start the steroid eventually because my pain was so bad. And when they did eventually start me on the steroid on the 5th day, which was empirically just to see that there might be some edema that the scan would have missed, and clinically thinking that it is. Within a half an hour, I responded to the pain control from the steroid. So that tells me that there was swelling in the brain.
So isn't that fantastic that within half an hour there was actually a huge response to the steroids?
Absolutely.
And I just wish they'd started this thing a bit earlier and not leave you in pain for such a long time. Okay. Now, did a question of infection, as you just mentioned that a question of infection came up, so did they not start an antibiotic or Did they feel it was too soon to start an antibiotic?
They're basically governed by the microbiology department of the hospital. And microbiology did not permit to start the antibiotic because when they did 3 sets of blood cultures, they were unable to pick up any organism that would have been precipitating the infection. So their conclusion was that it was the inflammatory mediators, which is, swelling related chemicals in the bloodstream from such a huge trauma into the brain. And obviously the operation theatre is sterile and only 1 dose of antibiotic was given at the time of operation. So they thought that the brain was covered and there was no other focus of infection. They did a chest x-ray which showed a little bit of lung collapse and atelectasis as they call it, although I didn't have any respiratory symptoms. They also checked the urinary tract and there was no infection there. So they were wondering where exactly the infection was from that was making me shiver and give high-grade fever. And they asked me what I thought, and I thought it's probably from the intravenous lines. So that was probably that infection plus the inflammatory mediators, as they call them. So eventually they did start the antibiotic, but which one to start was the issue. But in my conclusion, I think it was the steroids that really did the magic to get me through the pain.
Okay, so in your experience with such patients, and you being a patient yourself, are steroids the norm, or are they used as and when required?
I think it depends from doctor to doctor, but I would really be more liberal in using steroids because it's only for a short period. They're very good anti-inflammatories. They're very good for nausea and vomiting. They give you energy. They give you appetite. So they're all the things that a patient needs in the post-op stage.
So in the initial days, you would say taking steroids is not all that bad?
I don't think so. I think a week or 10 days on steroids.
Okay.
It's very beneficial.
Okay. And what other symptoms did you have in the post-operative period? May I just remind the listeners that today is actually the 18th post-operation day. 18th post-operation day. So it's just a little bit over 2 weeks that you've had a major neurosurgery.
That's right.
So
Yeah.
I want to know what other things that you were experiencing from the point of view of steroids or any other symptom that you were feeling.
I think there was a little bit of apprehension in my case because I'm diabetic and hypertensive. So the steroids do put up the blood sugar and they put up the blood pressure. But in my case, the blood pressure was running low because I wasn't eating anything and I was lying down. I could barely walk to the bathroom without support. And there was huge swelling around my face, and I'll show you the swelling.
All right, this is swollen, all right, yes.
Yeah.
Okay.
It's a ghastly sight, but as you can see, I've recovered so well. Yeah. And I would also like you to see how much pain I was in, and that's how much pain I was in.
Yeah. Mm-hmm.
So I think the surgeons were a little bit apprehensive about the sugar control and what side effects these steroids might cause. But in my case, because I had a fantastic response, I would like to encourage the surgeons and the patients to actually talk to their doctors and ask if they might be started on steroids.
Okay, because a lot of people they are a bit apprehensive about steroids and also the fact that it gains weight and things like that. But I think at this stage, when you're having such a major surgery, gaining weight for a short length of time is not really a huge issue, is it?
Absolutely not. Absolutely not. The main thing is to survive.
Okay.
And I would encourage everybody. First of all, I would encourage everybody to go ahead with the surgery. There's nothing to be afraid of. Everybody has their own luck, but I think there's nothing to be afraid of. Everything can be managed properly. And clinically, I found that the doctors are good, but the nurses are really your advocate. Because when there was a delay in my medication, the ward sister, she really pulled up the neurosurgeon and said, look, I think you should just stop looking at the scan and come and talk to the patient. When they did that, they were convinced that I needed them.
Fantastic. Yeah. Now, there are a lot of people who would be watching this video because you're making this video with the intention of allaying any kind of anxiety which people might have who are not on the side of the fence that you are on right now. So, would you like to give them any piece of advice or a message that they might benefit from?
I think I would encourage them to trust God, and if they have any questions that I have not covered the answers to, they're welcome to write and ask me when we upload this video. And basically, I think, your luck is the main thing, your faith is the main thing, and having a meningioma in the frontal lobe was not a bad experience to me because I have had a full recovery. Everybody might not be the same, but you have to balance the risks and the benefits. In my case, I've been very lucky.
Look, thank you very much. You've been fantastic, and I think a lot of people would benefit from your experience. And I hope that even if you can relieve the anxiety in even one of the viewers, I think this job would be a great success. Thank you very much once again, and congratulations on a fantastic recovery.
Thank you very much.